patient.
Thank you, Dr. Manisha. So my talk is basically on the need for how a super specialized or a specialized lab can actually handle samples not only for microbiology, for cytology, we even make cell blocks. So the talk is we get samples from within the hospital and from outside the hospital. So the extreme importance is the conversation between the clinician and the microbiologist and the pathologist to happen. It, Dr. Manisha, if she has a case, she informs us either a day before or on the day. So we are prepared, and we know that's a high priority thing. We've heard of tumors, but we know what endophthalmitis can do to any of our patients, and we don't want to be going there. So it's very important. I'm not going to read out everything, but what we need to know is these steps to send samples are extremely important. My talk is very microbiology related, but it also means that whatever sample has come in from the vitreoretinal department has to be handled in one go for microbiology, for cytopathology, for cell block, all in there. You don't want to go back to the OR and ask Dr. Manisha and her team, please send us more diluted or pre-diluted sample. It has all to be processed and done in one go so that the answer to the clinical team is in total. So I'm going to just run through a few slides and just tell you why it's important. A KOH seen, informed through to the doctor is extremely important for them to start the direction in thinking. We saw that there's a case where they probably did not think it to be that, but it could just give them something to immediately start. A case at 6:30 in the evening with a KOH report is something that the clinical team and the patient care would definitely appreciate. We do gram staining and we do cytospins. We have a lot of ocular pathologists here. They would know the importance of seeing neutrophils, viral cytopathic changes, do a cell block, and even look for, we've had cases of atypical lymphoid cells also coming up. So it's very important that the sample coming into the lab goes through all your processes. We are lucky that everything is on one floor, under one roof, and we're able to do all of it. We get samples from outside with endophthalmitis, and we've, to our surprise, apart from bacterial and fungal growths, we've also had some rare cases of atypical cells, which we've gone back and also seen them to be cases of lymphoma. I'm not going to bore you people, but please make sure your lab is equipped with all media of all covering everything, and sending in to the OR is extremely essential that you've covered everything. You can't just send a blood agar and a chocolate agar and then ask for other things. This is part of our setup. It's extremely important to have validated instruments at the right temperature control, good biosafety cabinets, trained technicians. Over the last 100 cases that we've done, our most common ones have been aspergillus and fusarium. You saw a case of fusarium being presented by Dr. Manisha, and then the third commonest is the candida. We get a lot of, we have immunofluorescence also. We've learned a lot from Dr. Dipankar, who's, in fact, we've taken the dye from Dr. Manisha and we started doing that, and to our fascination, it's been a combined, it started with a WhatsApp group, and then we reached out to Dr. Manisha, who immediately gave us that, and we see some fascinating funguses. Maybe Dr. Manisha would not find the pictures great, but we find them really nice, and they can be used for publications also. Amongst the bacterial, the most common is staph, followed by strepto, and then Pseudomonas. So I'm not going to tell you, but I definitely would like to tell you, let's have conversations between clinicians and pathologists and microbiologists. Let's communicate, let's be vigilant, let's use the right regroup, reevaluate, and monitor so that the patient's clinical and labs care is excellent. So this is why our talk was a little different from all the rest. I had many cases of pathology, but we wanted to do this and get you interested in something which probably interests everybody in this space. Thank you.
Thank you.
Thank you very much.